Assalamu alaikum wa rahmatullah, doctors. Hope that everyone is fine and everything is okay with you. Hello for everyone, and thank you for being here today with us to attend this webinar. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. Um, so let me introduce myself at the beginning. I'm Dr. Ahmed Hisham Ibrahim. I'm an OET expert for about 6 years now. I'm a cardiology research fellow in Bournemouth in UK, and I'm meeting with you today to discuss everything about OET for anyone who's literally starting the pathway. Maybe he is at the end of the pathway, like he is doing the ESIF-MG certification in the United States, or maybe he is starting the pathway, something like PLAB, for example. So he is targeting GMC registration. Maybe someone is targeting Australia to work there to register for the PRA agency. Maybe someone is traveling to Canada. So, whatever the country is, eventually and mostly you will need the OET through this pathway. Okay, so first of all, I'm so delighted, and it's my pleasure to have this webinar with you by kind invitation of course, Dr. Hafiz, the well known to all of us. I really thank him so much for such an opportunity. Um, and we are going to discuss everything related to OET. So for anyone who wants to take any notes, maybe, or maybe write something that he wants to ask about at the end of the session, we will open the door for all questions. So anyone who is having a question, of course, definitely he can do that. Okay. Let me tell you that, as I told you, I've been giving OET for about 6 years now. I have different platforms with thousands of candidates there, and hundreds of those candidates, mashallah, are working now. Some of them are in the United States, some of them are in the UK, they are in the specialty training, others are working now in Canada and Australia. So thanks to Allah, many of them are working now and they have achieved their dreams by registration either to the GMC or ESIF-MG certification and other stuff. So we are meeting today to speak about OET. Maybe some of you don't know what is OET exam, what does it tends to do actually, what does who it is aimed to be taken by, and that's what we are going to talk about. Okay, so Bismillah, let's start now. We are talking about some specific exam called OET, which is Occupational English Test. This is what we call OET, or Occupational English Test. Okay, what is this test exactly? It's a test which is aiming for, or it's a medical English test related to occupation. So it's a medical English test related to occupation. So if we are talking about maybe doctors, nurses, physiotherapists, pharmacists, dentists, radiographers, everyone who is going to deal with anyone in the medical field, everyone who is related to a medical profession is uh, wanting or will be intending at some point to take this exam, the OET or the Occupational English Test. Some of you may ask, Doctor, we have heard a lot about other tests by which we can do the registration or complete our own pathways. Yeah, that's right. And that's what I am going to tell you about. Here, some of you may speak and compare between OET and IELTS exam. So we are having two exams actually in our pathway. In order to get registration, you can have either OET or IELTS. So what is the difference, doctor? What is the difference between OET and IELTS exam? As I told you, OET is meant to deal with medical workplace scenarios. Medical workplace scenarios. So, what does he test me actually to do, doctor, here? He is testing you in how to do communication in clinical context. That's it. So, it's not general English. Of course, definitely, it's not a general English exam. It's an exam specified to medical workplace scenarios or communication in clinical context. So, as I told you, if we are talking about something, maybe something like medicine, okay, nursing, physiotherapy, pharmacy, dentistry, and so on. So, we have different professions having the same exam, which is OET. Of course, definitely, there will be a difference between each profession and the other related to this kind of exams. There will be some difference in two subtests in the exam, and we will be discussing that later. However, it's talking about the same context, which is medical workplace. So, what about IELTS, doctor? If I want to speak about something like IELTS, what is the difference? What is the real difference between OET and IELTS? First of all, IELTS is talking about general English. So it's a general English test. So what do you mean exactly by that? I mean, in this kind of exam, you will be tested for topics including everyday topics or academic topics. So, for example, you can have an exam talking about education or hobbies or technology or sports, any stuff like that. You can have an exam related to any of those fields, maybe something related to tourism, maybe something related to, um, for example, technology, industry, and so on. So that's what we are talking about. It's related to everyday topics. However, you will never find that in the OET. In the OET, doctor, you will only be tested for medical topics. For example, you are writing a routine referral to another specialist, asking him to do evaluation, to do assessment, to do management for a specific patient. Maybe you are speaking to a patient, asking him about the symptoms that he is experiencing, about the signs or the examination that he is doing, about the treatment you are discussing with him, the treatment plan, and so on. In the listening, for example, in the OET, you will hear a conversation between a doctor or a nurse and a patient, and you will be asked to fill in the missing parts or the missing spaces with what? With medical words. Medical words only. So you will never be at the risk of facing general topics that you have no experience about. It's all about the medical field that you are literally working in. And that's what we call the OET. And that's definitely the advantage of the OET related to IELTS. Okay? This is the first thing. Those are the first or the general guidelines in comparing OET to IELTS. Okay, this is perfect. So, if we want to talk about the OET itself, what does it aim for? Yeah, it aims for many things. Maybe you can do some registration for registration in the UK. And by UK, I mean, of course, England, Ireland, Scotland, and Wales. All of those lie within what? They lie within GMC registration. So to get the GMC registration, you need to get grade B in the OET, and we are going to discuss that in details. You need to get grade B in the OET in order to have GMC registration, to be able to practice medicine in UK. By that I mean England, Ireland, Scotland, and Wales. What else? Some some of the doctors, okay, some of the doctors are taking OET, for example, to do registration in Australia through the regulating body which is called AHPRA, something like the GMC, which regulates the medical practice in the Australia, and that's why they are getting the GMC registration. Some of them, some of them are wishing to do registration in the United States through the ESEF MG certification. And I think many of you are going through this pathway, the pathway of the United States or ESFMG certification. A very little number of candidates are going through the pathway of Canada. It has its own specifications, actually, to be honest with you. However, the most common countries are the UK, Australia, and United States. Those are the main countries for which the candidates are, those are the main countries for which the candidates are taking the OET in order to do the registration. Okay, this is regarding what it do exactly. Okay, doctor, I have a question, please, before I start anything. How much is the exam? What is the price of the exam, doctor, please? The exam costs 587 AUD, Australian dollars, which is equivalent nearly to 400 USD. Okay, I think in British pound it's about 350, some stuff like that. However, those are, or this is the main average price. It's about 400 USD. Okay, so how can I take the exam? What do I need to do to take the exam? What is the validity of such exam? The validity of the OET, doctors, is 2 years. The validity of the OET is 2 years. So within 2 years, you need to do or to complete the ESFMG certification or the GMC registration. At some specific circumstances, and I think some of you know that, if you had your PLAB 2 exam after 2 years of OET, then you need to finish the registration within 3 months of the PLAB 2 exam in order to maintain the validity of the OET. Anyway, it's a general thing. It's a general thing, honestly, and most of the candidates don't tend to do that. So typically and genuinely, the validity of the OET is 2 years. So you need to do registration within 2 years of the exam. Okay, this is perfect. So, doctor, how can I do an account? How can I make an account? And what do I need to do to take the exam? That's what we are going to talk about. Okay, in order to book an exam, you need to sign up at Occupational English Test. It's a main site in which you need to do sign up there. Okay, when you sign up in the OET, you will then find that you are able to make an account, and through such account, you are going to book your exam. The exam will be one of two. The exam will be one of two. And that's what we are going to say in details from now on. Please focus very well now. We are having two things. Okay? Paper based exam. We are having paper based exam and computer based exam. We are having two things, paper based and computer based. So, what is the difference? What is the difference actually? What should I take, doctor? What should I do? Let's discuss that now. Okay, so if we are talking about the paper based exam. In such type of exam, you will be going to a specific center. Some of you will be going to some centers in Pakistan and so on, and you will take this exam. Okay? The paper-based exam, for each paper-based exam, there is a closing date. I mean, for example, we are having this kind of exam. There are two paper-based exams in each month. So we are having two paper-based exams in each month. One of them is at the start of the month and the other one is in the middle of the month. Okay, we are having two exams. And regarding the computer-based exam, okay, we are having many, many exams per month. Many exams per month are found for the computer-based. So that's why you are the one to choose between them. Either you choose the paper-based one, so you are able to choose from one of two exams per month, and there is a computer-based exam in which you can book at any time. For each paper-based, you are having what we call a closing date. A closing date means that you are not able to book the exam after this specific date. So for example, if you are going to have an exam on 21st of February, okay, after 19 days, so the closing date will be around 3 weeks before the time of the exam. So the closing date will be 1st of February. After 1st of February, you cannot book this exam. But for the computer-based exam, the closing date is so close to the exam. Maybe you can book your exam about 4 or 5 days before the exam date. So it's fine. So what do you prefer, doctor? What do you recommend? And actually, doctors, please focus very well. This point is not discussed by many, and this point can be actually a struggle to determine. Okay? Computer based is having some advantages and also some disadvantages, and the same for the paper based. Let's see. For example, if you are going to have the computer one, you need to what? Write very quickly on keyboard. Doctor, you must be able to write and type very quickly on keyboard. You need to type very quickly on keyboard, doctor, if you are going to have this one. You need what also? You need to have a well-established internet connection. And by the way, doctors, this has happened a lot. What do you mean, doctor? I mean that many and many candidates, their exams were cancelled because they don't have a well-established internet connection. The internet was maybe lagging, maybe there was some sort of crash, and unfortunately, they lost the money and they lost their exam. So this is a very important point. Okay, what else? What is the advantage of the computer based related to the paper? One advantage is the results. The results, okay, are out after 2 days. You know that? The results in the computer-based exams, doctor, are out after 2 days only. So what about the paper-based exam? It's after 14 working days. 14 working days, of course, with excluding Saturdays and Sundays. So the results in the paper-based are out after at least or around 2 to 3 weeks. But in the computer-based, you will get the results after 1 or 2 days. And that's an important point, by the way, for many candidates. That's an important point because many of you are targeting for matching, maybe, or they are having a specific time frame for registration. So they don't want to wait. So in the paper-based, before you get into another exam, of course, definitely you need to know the results. The results here are after 14 working days. However, in the computer-based, it's only after 1 or 2 days, and that is an advantage. Doctor, but I heard something. I hear that the computer-based exam can be either center, can be at either center or home. Is it right, doctor? Yes. The computer-based exam can be at a center or at home. However, whatever the place is, doctor, whatever the place is, whatever, either it's a center or home, eventually you will have the speaking subtest at home. Doctor, even if I have all the subtests at the center, like listening, writing, reading, will I need to do the speaking subtest at home? Yes, doctor. Yes, you will need that. You can't have, again, doctor, you can't have the speaking subtest at the center. You must do it at home. And that's why I've told you to have what? A well-established internet connection. If you don't have a well-established internet connection, doctor, and a good laptop, there will be a challenge, there will be an obstacle in the computer-based exam. So please take care of this point. Okay, great. What about the paper-based one, doctor? What are the advantages? As we are going through the different subtests, doctors, we will know that in the paper-based, you are allowed to do highlighting to every single word found in the case notes or in the papers of the exam. What do you mean by highlighting? I mean something like that, for example. I'm able to do that. I'm able to do that. Or maybe with my pencil, like this one. I'm able to do that in the paper based, of course, without colors. I mean, you can do with your pencil whatever you want. You can do with the pencil whatever you want. In the computer based, there are restrictions. You cannot underline every single word in the exam. You can't do that. So in the computer, you are able to highlight some things that we are going to discuss later. However, you cannot underline every single word in this type of exam. But in the paper, yes, you are able to do that. Doctor, is it necessary? Is it necessary for us to, through the exam, to underline words? From my own point of view, yes. I understand and I know that for some doctors, they don't care about that. It's fine for them not to underline any words or write anything. However, for many others or for many other doctors, yes, they need to underline and they need to write some hints or some notes in the paper of the exam. It's not it's not available. It's not permitted in the computer based. However, it's permitted in the paper based exam. So, of course, definitely this is an advantage. Of course, also at the paper-based exam, you don't need to type very quickly on keyboard. There is no keyboard, right? You just need to write quickly with your pencil. And that's very doable. So it doesn't necessitate a specific skill like typing very quickly on the keyboard like in the computer-based. So eventually, doctor, what do you recommend? Doctor, I usually explain everything and tell you everything, and you are the one who determine what to do exactly. Maybe some doctors don't have a center for paper-based exam close to them. Yes, there are some countries in which you cannot have a paper-based exam. Yes, this happens. And there are other countries where you cannot have a computer-based exam. So you are the one who determine what to do. I'm telling you the pros and cons of everything. So the advantages of the paper based that you are able to underline, you are able to take notes, you are able to write whatever you want on the paperwork or on the paper on the exam paper. On the regarding the computer based, the results are out very quickly. However, you cannot underline everything, you cannot write everything. From my own point of view, is that something like reading subtest is a little bit easy on the computer-based exam because copy and paste is available in this test. Yes, you can do copy and paste regarding the writing or regarding the reading. Yes. So everyone has its pros and cons. Everything, by the way, will be much clearer when we go through the subtests themselves while explaining how to tackle them and what to do exactly. Later on, inshallah, everything will be clear regarding this specific point. Okay? That's only a general speech about the difference between the paper and computer and what to expect exactly. Okay, so doctor, what are the subtests for the OET? What are the subtests? We are having listening, okay, reading, writing, and speaking. We are having four subtests regarding the OET. They are testing you, doctors, regarding four subtests: listening, reading, writing, and speaking. Okay, for everyone or regarding each one, you need to score, doctor, 350 at least out of 500, which is equivalent to what we call grade B. I'll explain everything in a moment. So in the listening, you need to get 350. In the reading, you need to get 350. In the speaking, also 350 out of 500. Doctor, what about the writing? In the writing, doctors, in the writing, we are having two things. We are having two things. Doctor, if you are targeting for GMC registration in the UK, then you need 350 at least out of 500, which is equivalent to grade B. However, if you are targeting Dr. Isif MG in the United States, you need only 300 out of 500, equivalent to grade C plus. This is the only difference between the GMC registration and ESIF MG certification. So for both UK and United States, you need to get grade B in listening, which is 350 at least. Of course, 350 and above, like 360, 370, and so on. But you are not allowed to get less than 350. The same for the reading, doctors. The same for the speaking. In the writing, it depends. It depends on your destination. So if, for example, if you are targeting the GMC registration, you need to get 350 at least. If you are targeting ESIF MG certification, it's a bit easier, to be honest with you. You only need to get C plus, which is very, very, very doable, by the way. Okay, this is great. Doctor, I heard about something called resetting one subtest only. I mean, for example, doctor, if for any reason I fail the listening subtest, if I fail the listening subtest, doctor, will I be able to reset the listening only? Unfortunately, doctors, no. Unfortunately, no. If you are targeting the GMC or the ESIF MG certification, you cannot, doctors, reset a specific subtest. You cannot do that. Okay? You cannot reset a specific subtest. However, you need to enter the whole exam again. Doctor, I heard about something called the clubbing, in which if I fail one or two subtests and then enter the exam again and I pass those two subtests, I'll be able to combine grades together of the two exams. Unfortunately, this is not allowed, doctors, in the ESIF MG or the UK. Yes, it's allowed for some specific areas in Australia. Yes. I had many candidates in Australia who were able to do a combination or to do clubbing between two exams, and they are now, by the way, working in Australia. Okay, they did not pass, for example, one or two subtests, and then they enter the exam again. Of course, the clubbing has a specific rules. Okay, there is no room to talk about that now. However, it has a specific rules that they entered another setting and they were able to pass the two subtests that they failed before. And after that, they did the clubbing and the results were approved in Australia. Yes, yes, it's very doable there. However, if you are going through United States pathway or UK pathway, you are not able, doctor, to number one, reset a specific subtest. You can't do that. And you are not able, doctor, to do clubbing. Of course, definitely, I'm talking about medicine profession. I'm not talking today about any other profession. For example, clubbing is available in nursing. However, I'm talking about medicine now. You are not able to do clubbing in medicine if you are targeting ESFMG or UK pathway. Okay? So, what have we done now? What have we talked about now? We have talked about the difference between OET and IELTS. And what is this exam actually targeting? We have talked about the different subtests of the exam, the cost or the price, the validity, how to book the exam, the difference between the paper-based exam and computer-based one. For now, I'd like to give you some hint about what to expect in the writing and the speaking subtest. What to expect regarding those ones. Of course, definitely regarding the listening and the reading subtest, we are going later on to discuss that through the sessions themselves or through the webinars themselves. And what to do, of course, definitely in the listening, he is examining you, he's examining your listening proficiency. How are you able to listen to the patient or to maybe to doctors or a doctor and patient talking, and how are you able to understand that and answer with the correct one? Of course, we are going to talk about that. And in the reading, he is testing or examining you how quick you are to read a specific paragraph and answer the questions regarding this specific paragraph. You will need to increase and improve your vocabs, doctor, to be able to pass the reading subtest. You need to be very quickly while reading the paragraph and answering the questions, and all of that we are going to talk about. And that's why, Alhamdulillah, we are famous for such things which we call the clinchers, the high trends, the recalls, because as you know, I'm having hundreds and hundreds of candidates every single day. I'm having candidates who are taking their exam, so I'm usually aware of the international trends of the exams. What do they tend to bring in their exams? Like on the exam of 24th January, about a week ago, they brought a new letter in the exam. So that's what we are going to talk about. The new trends, and by the way, the trends are changing maybe every month, and the clinchers or the recalls regarding the listening, reading, writing, and speaking. They are usually repeated in the exams. Okay, let's talk now about the writing subtest. The writing subtest, you ought to write a letter to a professional. Of course, definitely, right? You are ought or you should write a specific letter to a consultant, to a specialist, to a nurse, maybe, whatever, right? So, regarding the writing subtest, you will either have a routine referral or an urgent referral, and we are going to discuss that in a moment. An urgent referral. You can have something like referral to non-medical profession, maybe referral to non-medical profession. And by the way, this is a new letter that has appeared about a week ago. You can have a discharge letter, okay? And to a very little extent, you can have something called transfer letter. So you can have one of those. Doctor, what do you mean by the routine referral? In the routine referral, doctors, I mean that you are referring the patient to a specialist or to a consultant. What do you mean? Something like endocrinologist or cardiologist or whatever. Maybe I'm having something like the patient is having something like rheumatoid arthritis or systemic lupus, for example. So I'm going to refer him routinely to a specialist. Maybe some patient is having or suspected with PCO. So I'm going to refer her to a gynecologist or women specialist and so on. So in the routine referral, I'm referring the patient to a specialist because the patient is having a specific condition. Maybe something like diabetes, maybe thyroid problem, maybe rheumatological disorder, maybe gynecological disorder, maybe he is a child with a specific problem, so I'm referring him to a pediatrician and that's it. Doctor, what do you mean by routine referral? In the UK, in the UK, doctors, the routine referral is at least more than 2 weeks. The routine referral may be within a month, within 2 months, within even 3 months, yes. But it's more than 2 weeks, doctors. And why is that, doctor? Why is that? Why I'm referring the patient to a specialist within more than 2 weeks? Because the condition is not life-threatening. The patient is having maybe some things related to diabetes or related to thyroid, hyperthyroidism or hypothyroidism. So as a GP, I'm going to handle this patient till he sees the specialist. So there is no need for the patient to be urgently referred to the specialist. And from here comes the point of the urgent referral. Doctor, please think of the urgent referral as if life-threatening condition. Doctor, the urgent referral is like an immediate referral. Of course, there is a difference between them. However, in the OET, you can consider it like that. It's a life-threatening condition. It's an immediate referral. Like what, doctor? Like maybe the patient is having something like MI, myocardial infarction, or pneumothorax, or any stuff leading to severe shortness of breath. So if the patient is having any of those, can I wait? The question is, can I wait, doctor? Can I wait for the patient to be referred after 2 weeks or after some time? Of course, definitely no. Why? Because the patient is going to lose his life. If the patient is not referred immediately, if the patient is not referred direct away to the hospital, to the emergency department, he will lose his life. It's a life-threatening condition. And also the urgent referral includes something called cancer pathway. The cancer pathway is called 2-week wait referral. Okay, let it be here so that it's clear for all of you. So I'm talking about now life-threatening condition like myocardial infarction, pneumothorax, severe shortness of breath, or cancer pathway. Doctor, the cancer pathway is called 2-week wait referral. May I know why, please? The patient here is having symptoms and signs indicating cancer, like maybe cancer bladder, like cancer lung, and so on. So we are going to refer the patient within 2 weeks to be seen by the specialist for further assessment. This pathway within 2 weeks is called 2-week wait referral because the patient is going to wait for 2 weeks to be seen by the specialist, or sometimes we call it cancer pathway. In the OET, it is urgent referral. So in the OET, we are having one of two, and we consider both of them as urgent referral. Either life-threatening condition like MI, pneumothorax, severe shortness of breath, whatever, or cancer pathway. So whenever I see in the exam the word the cancer in the case notes or in the letter, of course, definitely, I'm knowing now that it's an urgent referral. Okay, this is great. Let's talk about the point of non-medical profession. What do you mean by non-medical profession that has appeared, doctor, in the exam recently? Non-medical profession, doctors, mean something like occupational therapist or radiographer, or, for example, scheme manager, or maybe psychologist. Of course, not psychiatrist. Psychologist, not psychiatrist. Okay, the person who is giving CBT or cognitive behavioral therapy and so on. Doctor, why do you consider those as non-medical profession? What do you mean by that? I mean, doctors, that when you are talking to one of them, when you are referring a patient to one of them or writing a letter to one of them, you shouldn't include any medical jargons in your letter. Doctor, you shouldn't include medical jargons while writing to any of them. For example, one exam I remember that it came about, don't know, few months ago. There was a patient who was having pulmonary embolism. Okay, the patient had an attack resembling pulmonary embolism. It was like pulmonary embolism, and he had the specific treatment. Okay, he had anticoagulants and so on. And after some month, he developed post-traumatic stress disorder. Every day, he has nightmares. He has nightmares that he is experiencing again this pulmonary embolism. So the letter was talk to the psychologist and tell him that this patient needs to take some CBT or cognitive behavioral therapy for that. When you are talking to the psychologist, doctor, can you mention to him that the patient is having pulmonary embolism? No. Why? Because the psychologist will never know what is pulmonary embolism. So what should I say, doctor? You should say something like, the patient experienced a clot in the lung, an attack of respiratory distress, severe shortness of breath. He had a clot in the leg. For that, he was commenced on or started on what? Blood thinners. Don't say anticoagulants. No, say blood thinners. So, by referral to non-medical profession, I mean, don't use medical jargons, don't use medical words while talking with such a profession. So, if you are talking to a psychologist, occupational therapist, radiographer, and so on, don't use medical jargons. Don't use something like anticoagulants or pulmonary embolism. Don't even say names of medications, because some letter the patient was taking something like baclofen. Okay, you can't say to the psychologist or to the occupational therapist that the patient was prescribed the baclofen. What is baclofen? I don't know that. So this is the idea. Don't use medical jargons while talking to any of them. And while going through the sessions, of course, we will be discussing who is the occupational therapist exactly, what are his duties exactly, and so on. Okay, what about the discharge letter? What is discharge letter? In the discharge letter, in the discharge letter, you are you are having a patient admitted at the hospital. So here you are having a patient admitted at the hospital, and what? You are referring him back to his original place. Maybe something like the GP. Doctor, to cut it short, who are you in the routine referral or the urgent referral or referral to non-medical profession? Who are you, doctor? You are writing the letter. Who are you? You are the GP. You are the family doctor writing to a specialist. In the routine referral, you are writing to either cardiologist, endocrinologist, and so on. In the urgent referral, you are writing to an emergency department, to the hospital, and so on. In referral to non-medical profession, you are the GP talking to a psychologist maybe. In the discharge letter, you are not the GP. You are writing to the GP. Who are you, doctor? You are a patient working at the hospital. So let's say, for example, a patient was admitted. Of course, here we are talking about the discharge letter. Let's say that the patient was admitted to the hospital with meningitis, okay, with bacterial meningitis. And after that, he was prescribed some medication, he had investigations, lumbar puncture, and so on. And he was treated, okay, and fully recovered, and now is going to be discharged from the hospital back to the original place. So we are having now a patient admitted at the hospital. You are a doctor working at this hospital, referring the patient back to the GP. You are updating the GP about his patient's condition. And that's why in other contexts, this letter is called update and discharge letter. So I'm updating the GP about his patient's condition and I'm referring him at the same time to the GP. That's what we call discharge letter. Okay, what about the last type, which comes in the exam, to be honest with you, to a very little extent, transfer letter. In the transfer letter, I'm referring the patient from a ward to another, from ED to a ward, or maybe from hospital to another. Let it be here, and I'll make an arrow like this. So in the transfer letter, I'm referring the patient from a ward to another. So let's say I'm having a patient admitted to the rheumatology department because he is coming with a flare-up of systemic lupus, okay? And now this patient is suffering from severe dyspnea, severe shortness of breath, and needs to be assessed by either a pulmonologist or a cardiologist in this ward. What shall I do? I will transfer the patient from my ward to the other ward. I'm going to transfer the patient from the rheumatology department to the cardiology department to be assessed by the specialist. That's a transfer letter. Maybe some patient was or has come to the emergency department and we need now to admit him to a specific ward. What shall we do? Transfer him from the ED to the ward. And also, I can transfer the patient from a hospital to another for a specific procedure. However, this is not a common type in the exam. What usually comes in the exam and what will be discussed in details, inshallah, the routine referral, urgent referral, referral to non-medical profession, and discharge letter. Doctor, if you master the four of those, you will get grade B in the writing in the exam. Okay? This is the core of the writing that we have. Okay, that's great. In order for this webinar not to be long, I'll give you only some intro about the speaking subtest. Doctor, in the speaking subtest, we have talked about the writing, listening, and reading. In the speaking subtest, you are talking to an examiner or interlocutor. Who is this examiner or interlocutor who is maybe simulating the patient? So in the speaking subtest, doctor, you are a doctor, of course, and you are talking to a patient. Who is this patient in the exam? He is the examiner or interlocutor. So in the speaking subtest, there will be cards. Cards, what we call cards. You will have a card for a doctor, and the interlocutor in front of you will have a card related to the patient. Okay? And now you are going to make a conversation between you and the patient for about 5 minutes. How to pass such subtest? How to pass it? Of course, definitely we are going to talk for hours about the different ideas of the cards, what to do exactly, and so on. But this specific subtest needs you to talk fluently without hesitation or lagging. I'm going to explain everything now. And also needs from you IPS. And this IPS includes two things: tone of voice and some sentences. Doctor, what is that, please? What do you mean by that? In order for you, doctor, to pass the speaking subtest, you need to talk fluently without hesitation or lagging. He doesn't need you, doctor, to be a native speaker. Of course, definitely, all of us are IMGs. Okay? We are not native speakers. And you don't need to be a native speaker. You don't need to speak like a native person in order to pass this speaking subtest. What he needs you to do, what he needs to make sure about, that you are able to listen to the patient, understand him very well, and deliver your information to the patient. So you are able to listen, understand, tell the patient about information or deliver information to the patient, and make sure that the patient is understanding you. If you are able to do that, you will get grade B in speaking. That's it. So that's it. What do you mean by without hesitation or lagging? He doesn't need you to talk like, because some doctors talk like, hello, I am Dr. Ahmed, the treating doctor. No, no, he doesn't need you, doctor, to talk like that. Hello, I'm Dr. Ahmed, the treating doctor for today. How may I address you, please? Hello, Joan, it's nice to meet you. Please take a seat. So how can I help you today? It's like that. That's it. Doctor, what do you mean by IPS? It's interpersonal skills. What's interpersonal skills? Interpersonal skills, doctors, mean communication skills. Generally, in any OSCE exam, the communication skills are based on the facial expressions, the tone of voice, and the hand gestures, right? You are talking with maybe a smiley face or whatever the condition is, and your tone of voice is expressing what you want to say, and you are using some hand gestures with it. This is in any OSCE exam. In the OET, the exam will not depend on the facial expressions or hand gestures. Why? Because there is no camera in the exam. The exam of speaking is recorded only, is audio only. It's recorded only. And by the way, doctors, the examiner in front of you or the interlocutor is not the person evaluating you. He is not the person, doctor, giving you the grades. His role only is to act as if he were the patient. He is going to speak with you as if he is the patient, and this conversation will be recorded, and after that, this record will be evaluated. So the examiner in front of you is not the person who will give you the grades. He is not the person who will say you will get grade B. No, the examiner is not that. Maybe sometimes in the computer-based exam, maybe this person or the examiner is the person who will give you the grades, but this will never happen in the paper-based exam. In the paper-based, the person in front of you will never be the one who is going to give you the grades. Okay? So, again, doctor, you need to speak fluently without hesitation and you need to apply communication skills. Doctor, you are telling me that this exam will not be recorded by video, it's audio only. So, what shall I do? This depends, doctor, on your tone of voice. How are you going to say some sentences in a specific situation? And also some sentences that we are going to know later on in the speaking sessions, that we are going to memorize what to say and in which part exactly we are going to say that. That's it. If you do that, doctor, with talking fluently without hesitation or lagging, if you know the topics that usually come in the speaking, you will be able to pass with grade B. The last thing, doctor, what shall I expect? You told me in writing that there are routine referral, urgent referral, and these things, and those stuff, okay? What shall I expect in the speaking? Maybe the patient is coming for a first visit. Maybe you are having a second visit. The patient is coming back for follow-up. or for test results. You are going to have what we call examination cards, and we are going to discuss that, inshallah, throughout the sessions. You are going to have emergency department cards. You are going to have what we call breaking bad news, like breaking bad news for some patient with cancer. You are going to talk about already known patient, like patient admitted in ICU or maybe about to undergo surgery. Okay, so we are having first visit, second visit, examination cards, emergency department cards, breaking bad news. You are talking about already known patient, like patient was admitted to the ICU. For example, if you are having patient doctor admitted to the ICU, you can't come to him and say, "How can I help you today?" Doctor, of course, definitely it's not logic. It's not logic to talk to a patient admitted to the ICU because he is having, for example, severe pneumonia, and you say to him, "How can I help you today?" Of course, it's not like that. Or maybe some patient was admitted because he is going to have a surgery today and he is about to enter the operating theater suite, and then you come to him and say, "How can I help you today?" It's not like that, doctor. If you say to the patient, "How can I help you today?" in such situation, it means that you know nothing about the patient previously, which is completely wrong because the patient's name and details are recorded in such condition. The patient is in the ICU, doctor, so you can't say to him, "How may I address you?" or "How can I help you today?" Of course, definitely this will be wrong. Okay. Also, if you are having, maybe sometimes you are having a patient who is reluctant or refusal patients, okay? Or maybe angry patients, how to deal with all of that. Do you think, doctor, that in the exam when you tell the patient, "Please stop smoking," do you think that the patient will reply by saying, "Okay, doctor, I will stop smoking"? Of course not. So how to deal with such patient? How to negotiate with him? How to do the negotiation with the patient? That's what we are going to do. How to deal with an angry patient? "Hey, doctor, I have been calling the doctors and nurses for hours and no one is answering me. No one is responding to me. I'm completely angry now and I want to file a complaint, please. Okay, I'm not happy with that." How to deal with such patient? Okay, and finally, there may be some cards related to lifestyle. And by lifestyle, I mean diet, exercise, smoking, alcohol. That's it. So we are talking about cards related to the diet, how to advise regarding diet exactly, regarding exercise, regarding smoking, and regarding alcohol as well. Okay, doctors, OET exam and the curriculum or the stuff that we are going to learn throughout studying the OET or maybe through the OET course and other stuff, it's not only, wallahi, for the OET exam only. You will know that when you start working in the United Kingdom or maybe in the United States. Because at some point, doctors, at some point, you will need to write a letter to a consultant. You will need to speak with an angry patient. When you become doctor, a senior house officer in the UK, you will need to do breaking of bad news to the relative. How will you do that? So, studying those things, doctor, will allow you to talk with the patient with confidence. You will be able to do the work, and later on, that will make you, doctor, a good doctor with good reputation. You are able to write routine referrals, urgent referrals, discharge letters, transfer letters. You are able to speak to anyone without medical jargons. You are able to deal with a patient coming from for the first time, for the second time. You are able to deal with an already known patient, with an angry patient, patient refusing something, and so on. Okay, I'm so sorry if the session was long for you. I'm so sorry about that. But those are the stuff that I really need to tell you about, and I hope that you enjoy.